Kathy's used up a couple of my first slides telling you about Selwyn, so thank you for telling us a little bit about Selwyn. But our journey started in 2008 with robots, and I'm going to bring you right up to today. And certainly some of these robots that you see from the early days are nothing like the nanotechnology that we just looked at, and it still isn't. But however, it's a journey, and it's an exciting journey. So bear with me for a little while and come on that journey. We are 60 years, and we are an organisation that focuses on the elderly population, the aged people, and we have 9 retirement villages, and our focus are on these 4 critical areas. Obviously, we are a charitable organisation, and we have identified what vulnerability looks like in 2014, the 60th birthday of the organisation, and it's loneliness and social isolation, social housing and hardship support. Obviously, looking at the whole person, including linking with many of you for the health journey as well. We need to keep on learning. We need to focus more and more on the community, and as an organisation, that's what we are doing, as opposed to gated communities, looking at the many people that need our services in the community to address those core issues of ageing. So 2008 was when our robotic trials began. And I need to acknowledge the University of Auckland, who have been a significant player in this whole journey with us at Selwyn. So many countries are facing the challenges of an ageing population, including providing care for people with deteriorating health and declining physical and mental capabilities. This is coupled with the challenges of a shrinking workforce and shortages of healthcare professionals. Advances in technology are able to offer increased remote monitoring and management of older people with or who need care needs. The Health Bots project was an international collaboration between Uni Services, the university's commercial company, South Korea's Electronics and Telecommunications Research Institute, and South Korean companies ED Corporation, Eugen Robots, and ISAN Solutions. Trial studies that we initially conducted were focused on the acceptability, the feasibility, the benefits, and the risks of using robots in aged care. The first study was focused on looking at what the residents thought their needs were and their preferences were for robots. The results indicated several key roles for the robots in an aged care environment, as you can see from this slide. The results provided an initial guide for the tasks and appearance appropriate for robots to provide assistance in aged care and facilities, and they helped highlight their concerns. Residents were generally positive towards the robots. The robots were generous to the... In response to the 2008 study of needs and preferences, an early prototype of PARO service robot developed by Eugen Robot Company of South Korea was named Charlie by the residents, and it was programmed with the desired functions and trialled for a short period at Selwyn Village. Charlie incorporated touch screen technology and performed tasks as noted there, taking vital signs, managing medical and medication and giving reminders, and of course social and mental stimulation. It was found that this robot was acceptable to all of the trial recipients. For the 2010 trial, there were additional software applications incorporated, a redesign of the architecture and user interface, introduction of falls detection, location monitoring, and calling for help. 53 residents and staff participated in this particular trial. Each trial took about an hour and included an initial questionnaire, then 20 minutes with the robot, which would move towards and greet the participant. The robot assisted people in taking their blood pressure and blood oxygen levels, gave a hydration reminder, told a joke and played some music on a video. Residents and staff filled in a final questionnaire giving their opinion of the healthcare robot, what they liked and what they didn't like, and made suggestions for improvement. A further study was conducted about medication management on the same robot. The results were very positive. The main comments were ease of use, appearance, instructions, not frightening, clear voice. 91% rated the robot size was about right. 71% of the staff thought a robot would aid the burden of medication administration, but there were some negative comments. The voice and the sound, slow to respond, discomfort reaching the touch screen, and 50% of staff had concerns about its use for medication management. The suggestions for change to the robot were give it arms, a large remote rather than a touch screen closer to the person, timetable reminders, more entertainment, alarm, and for it to make drinks. It didn't say what sort of drinks. In 2011 and 12, there was a much wider and far-reaching study funded by the New Zealand Ministry of Science and Innovation and the Korean government. There was a huge number of robots trialled in this, and there were 6 different studies with the aim to inform the development of robots that are helpful assistants for older people and for their caregivers, to help older people to be more independent, happier and more socially interactive, and to help care staff by doing simple tasks and giving staff more time for the human interface of caring. The longer-term goal of the project was to develop technology, robotic devices and software which can be used to aid in the care of older people. And this is certainly not nanotechnology. As you can see, this is the shape and the size of the robots that were part of this particular study. As you can see, there were 31 robots overall, 100 staff involved and 100 residents, so it was quite far-reaching, this study. It showed that healthcare robots can be acceptable to some people in aged care settings, but there were no significant changes of quality of life or depression in residents as a result of the robots, when compared with the control group. This is possibly explained by the low usage as a result of residents having limited mobility and not being able to move to where the robots were located, or participants with cognitive impairment finding the robots too difficult to use. Overall, responses were mixed, with participants responding in a range of ways to the robots, with some positive, some negative, and some neutral comments. Staff tended to use the robots more often and had more positive responses than the residents did. Future research would need to give robots a stronger operational role in the care facilities. The study suggested that no major problems were caused by the robots in the residential care setting. Concentrating on improving robots' mobility and interaction to increase utilisation would be the next step. And obviously size and accessibility would be a big part of that. There was a further study involving 28 residents having an iRobiQ and PARO robots in their own rooms for a 6-week period. This randomised control trial aimed to investigate whether personal service type robots in the home of older people were feasible and acceptable, and to provide pilot information regarding their ability to improve quality of life, reduce depression, and improve medication adherence compared to a control group. Researchers also analysed how participants' attitudes towards the robots changed over the course of the trial. The study was held in residence apartments, and IBQ was installed on a tabletop to make it an appropriate height for interaction, while the PARO taller robot was freestanding. The robot applications were individualised to the participants' needs and communicated over wireless network services to a server which held participants' profiles and measurements, medication prescriptions, logs, and logged the robot activity. You can see the IBQ robot had a menu screen that used and could be used with touch to select the functions that were wanted. The medication management system was programmed by the health provider with the participants using participants' usual medications. The robot autonomously raised its arms and sounded a bell and said the participant's name or the resident's name, "It is time for your medication," each time medication was due. The robot asked a series of questions which the participant answered via the touch screen and guided the participant through taking each medicine. The robot asked the participant to confirm if they had taken each medication, if they felt unwell or had any side effects. If a participant's medication was missed, the robot sent an alarm to a duty cell phone, which would prompt the nurse on duty to take the clinical decision to take any action regarding the non-compliance. If the alert also included a message to contact the resident as they were feeling unwell, then an immediate phone call was made to ascertain the urgency of the clinical situation, and appropriate action would be taken following that conversation. PARO had simple Skype functions as well, and was available to be programmed to provide cognitive exercises, and a website showing information about the village and the calendar of events on that particular version. Residents reported that the following functions were useful to them: medication reminders, entertainment, Skype functions, blood pressure, and the date and time. The trial showed that it was feasible to deploy robots in such an environment, and that people can interact with robots and may accept them. The robot had no significant impact on adherence to medications, depression, or quality of life. The trials of these service-style robots concluded in 2012. The robotic studies showed that older people are willing to accept technology when it addresses a perceived need, and they see it can offer increased independence and retain the dignity of the user. However, to minimise the risk of older people finding it too complicated to use and giving up when faced with difficulties, robotic designers need to adequately research the needs and desires of the prospective users and recognise that older people have a different attitude towards technology than young people. Attitudes and abilities are important factors to the use of assistive technology by the older generation. Whilst it is unlikely that robots will ever replace personal care and even pet animals in residential care facilities, there is a place for such assistive technology in aged care. In an aged care setting, the health care robot could free up staff to spend more quality time with residents, which is an essential part of older person's care with frailties. They can be an aid to communication, health monitoring, a resource for stimulating interactive activities to relieve loneliness and boredom, a means of ensuring the ongoing well-being of people living alone, or an aid for assisting staff with simple tasks. However, it is unlikely they will ever replace human assistance. Tasks such as personal cares, providing medical advice, and assessing mood will always be met by human carers. But I think that's just been proved wrong by the nanotechnology. This was 2012, we're now 2016. The rise of the robots is an important issue for us to think about as our over 65-year population increases. How we support our ageing population needs to be well planned if we are to invest in technologies to cope with the changing demographics. Robots have a place, but the Selwyn Foundation sees telehealth care as more important. Using technology to support the individual in their home environment, therefore extending their independence and enriching their quality of life. So we're moving from service robots to companion robots. PARO. PARO is an advanced interactive robot modelled on a baby Canadian harp seal. It responds to touch and other stimuli in its environment by making soft noises, moving its head and tail, and opening its eyes. PARO is the world's most popular commercial robot for elderly people, with over 1,300 sold in Japan and others in use in Denmark, Germany, USA, Norway and Italy. It is certified in the Guinness Book of Records as the world's most therapeutic robot. In the USA, PARO is approved as a health device. So I anticipated that you might like to meet PARO, so I brought him along. So this is PARO. PARO has sensors down his back, down his side, responds to light and sounds. The whiskers and under the chin, they all have responses, and they are quite cute actually. So I quite like PARO. And I'll tell you shortly how it can reduce your blood pressure as well. But I thought it might be an idea, if PARO's not too noisy, yes, we can hand him around, because his name is Bill. The residents called this one Bill. So we'll hand him around, and you can just feel the sensation that if you're not giving him enough attention, he'll wriggle and squirm. So PARO is autonomous, so it can freely express its feelings, such as surprise and happiness. By blinking its eyes and moving its head and flippers, it can learn to behave in a way that the user prefers and can adapt to its behaviour according to emphasising those that are reinforced. It can also personalise the learned behaviours so that it responds to a particular stimuli in one way with one person, and it will with another person as well. But going around all of you, it'll get very confused. PARO will look in the direction of the sound and can recognise the voice of its users. It can learn its name. The user can give it a simple name which they might prefer. So as I've said, this one is named Tom. No, Bill. My note said Tom, but I was given Bill. Okay, so why a seal? Other companion robots based on familiar animals such as cats and dogs have been developed. However, people tend to have expectations about how these robots should look, feel and act, which limit their acceptability. In contrast, people generally do not have direct experiences with a seal, and so PARO is widely accepted without perceptions. PARO is a companion robot and has been found to have similar effects to animal therapy, which is calming and relaxing and can help improve physical health as well as facilitate communication and conversation. Using a real animal, PARO cannot bite, scratch, cause infection or trigger allergies. It will stay with you, and the person who is petting it won't run away from, and it won't cause a trip hazard. So it's also got antibacterial fur, so it's easy to keep clean. It can be particularly useful. It can be particularly useful to use PARO if a person is feeling upset or distressed. sad, lonely, or agitated. In clinical trials undertaken in Japan with residents who suffered from mild or moderate dementia, PARO improved mood and depression and decreased stress levels and generally made people more active. PARO also encouraged residents to communicate with each other and strengthen their social ties. Overall research suggests that companion robots have positive social, psychological and physical effects and in general promote a higher quality of life for people in elder care settings, particularly those with dementia. PARO was successfully trialled in one of our rest homes and villages in 2013. The results found people less lonely, more socially engaged, more inclined to talk to caregivers and others than those that did not interact with the seal. Sessions with PARO also brought about physiological benefits such as helping to lower blood pressure. This study was published and received attention internationally. As a result of these positive results, Selwyn became the first provider of services for elderly people in New Zealand to purchase the companion robots when we took delivery of our first 4 in 2014. A second 6-month-long randomised control trial was conducted by the Auckland University team in 2015, this time with residents with advanced dementia who attended the Foundation's day centres. This trial investigated whether PARO would be useful for people with dementia and their caregiver in the daycare environment and at home. We allowed them to take those PAROs home with it, and just to see how this would work for people in the community. The preliminary findings are showing that most people with dementia enjoyed their experience with PARO, smiling and laughing more while interacting with PARO at the day centre compared to others. Participants using PARO showed increased communication with each other and the researchers during the group sessions with PARO than without PARO. And participants with less severe cognitive impairment seemed to interact more positively when PARO was with them. Caregivers reported that PARO was soothing, reduced anxiety and improved the mood for the individuals with dementia. Findings suggest that PARO has potential as a personalised approach for enhancing the mood and social well-being of individuals with dementia, and the results will be fully published in August of this year. So we went from 4 to 13. We now have 13 of these which are spread around our villages and day centres, and they are certainly responding. Our residents love them and name them, and there are some great photos of how they are using them. So from service robots to companion robots, we thought we'd have another go at the big machines. And in 2015, we participated in a study to determine the feasibility of hosting a prototype delivery cart, or a go-kart, designed by the same specialist robotic manufacturers of Yujin Robot Company Limited of Seoul in South Korea. The go-kart was capable of transporting heavy items, such as laundry supplies, within a hospital setting. And the Foundation worked with Yujin on assessing the practicalities of applying the functions with one of our hospitals at Selwyn Village. The automated trolley maps its environment using a Wi-Fi communication and navigating system. It employs an array of 3D sensors to independently carry its cargo whilst avoiding people or other obstacles in its path. The developers were looking to assess the practical use of the go-kart in a hospital environment and then refine its functionality for possible adaptations in elder care and other hospital and healthcare facilities in the future. Such application could potentially offer health and safety benefits for staff, free up time so that more time can be given for resident and caregiver interaction. Selwyn hosted representatives from the Korean manufacturer who explored the application of the technology for the delivery of laundry, surveying the layout of our hospital buildings and scoping out the possible scenarios and delivery routes. We were pretty pleased to be part of this study. We were only one of 2 sites outside of Korea, one in Sweden and us in Auckland, who took part in this particular study. The study didn't go past this early stage. The laundry scenario was not compatible with other trials that were being tested in public hospitals. And I think the other main reason was that we weren't big enough. This kind of installation really would suit a very large public hospital, not necessarily our household model of boutique hospital beds. So, however, it was interesting and fun. So at Selwyn, I've talked about robots. There are lots of other things that we use regarding to technology, and we can't talk about them all today, but it's great to be part of an organisation that sees innovation and technology as part of our future. And wandering search, the smarts around our nurse call system, which is silent, so you don't hear any bells, but you can answer a family member when someone says, "No one's been to visit my mother today," and we can say exactly when they visited and how long they were in the room, and all of those things, which is a huge advantage dealing and involving the family in mum or dad's care. But it's not all an open slather. We do have to have and be very mindful that aged care is about relationships. We need to be careful about where we pitch technology over humans, and it is an enabler, offering huge advantages for efficiencies, but there still needs to be the human element in everything we do. For robots to have a stronger operational role in a healthcare environment, supplementing scarce human resources, their development will need to be economically effective and have quality of life benefits. And I guess that whole size and economics, we heard about that device for $200. None of these devices were that sort of price. So, we've done all of those trials with robots in our gated communities, if you like, and residential care and villages of robots and technology. But I guess we see 2 major things coming out of that. One is the companion robots have a real place, and I hope you're falling in love with Tom out there or Bill. But the other major driver is how we get technology into the community and closer to home. There is a huge potential here for doing this and to drive better outcomes, eradicate isolation, and challenging the old ways that we are operating and thinking in the community. Experience overseas demonstrates that well-executed telecare helps older people. We can better maintain their health, maintain their independence for longer, prevent unnecessary hospital admissions, and build resilience. We ran a pilot of what is called My Health Clinic at Home in 2015. We used touch technology to help those with a chronic health condition, monitor their health and receive timely healthcare support and advice from the comfort of their own home. The pilot was evaluated on an ongoing basis by the University of Auckland Uni Services, and it achieved the following results. 66% reduction in hospital admissions during the pilot. 90% of clients felt telehealth equipment and monitoring was easy to use. 75% felt their health status had improved with telehealth. Most would recommend it to friends and consider it good value. And feedback from GPs and nurse specialists indicated that telehealth was useful in making decisions around their clients. This year we are conducting a further pilot on social inclusion and virtual consultations. My Health Clinic at Home offers in-home video conferencing, and we will be piloting this component with our independent living residents from May 2016. The pilot will include video consultations with our on-site doctor, Skype connections with family and friends, and before and after questionnaires to evaluate the usefulness of this technology. This will enable us to further investigate the system as a tool for social isolation and its value for virtual consultations at home. So looking forward, what are we going to do, and how can we reach out to more people? So Selwyn has decided and is just going through the process of creating a joint venture with an Australian health technology service provider named Ferris Care Limited. And the company is going to be called Invigor, and it's going to be focused on the key pain points for older people and key pain points for healthcare funders. Reducing hospital admissions, greatly improving chronic condition management, and supporting those individuals with wraparound services, and providing rapid response with intensive short-term support. I think with aged care, everyone thinks it's a one-way journey. You go from independence at home, maybe into a retirement village, or maybe straight into rest home or hospital care. Actually, often you don't want it one way. You might just need a bit of help to go back to being independent again. And so we see these tools could relieve and lengthen the time that people stay independent in their own home. Our priority is to work with other service providers to assist clients in remaining independent, as I've said, and socially connected and healthy in their own home, so as to prevent and minimise their admission to hospital or residential care. And that social connection, social isolation and loneliness is a scourge for older people. We have 1,000 older people visiting our Selwyn centres. We've got 43 Selwyn centres out in the community. But we know right now there are 9,000 seriously lonely people out in the community of Auckland right now, and we're only touching 1,000 of them. And we know that loneliness and isolation impacts people's own health status. So there is a huge amount that technology can do to help a person's well-being. The company's service offering will include coordinated home-based restorative and re-ablement services, as well as care and support and health monitoring for patients diagnosed with complex care needs and chronic conditions. Invigor aims to develop new service solutions in partnership with key organisations in the sector. While the number of New Zealanders over 65 is estimated to grow by 84% by 2026, helping older people stay in their communities for longer with the aid of technology will also contribute to ensuring optimal management of the rising costs of healthcare services. Thank you for sharing that journey.